Hello and welcome to Legislative Report. I'm Anthony Tezak. Joining me today is State Representative Tom Murt from the 152nd District in Montgomery and Philadelphia counties. We're going to speak to him about his work as subcommittee chairman on mental health. Representative Murt, welcome.
Great to be here, Anthony. Thank you for having me.
We had you on a few months ago and we talked about your reappointment as chairman of the subcommittee on mental health. Can you tell us a little bit about how that's going?
To be very honest with you, as you and I have discussed in the past, there are not too many families in Pennsylvania or across the nation for that matter that are not impacted in some way relative to a mental health challenge, whether it's bipolar or depression or what have you. And we are trying to vet these issues a little bit and to educate the people in the Commonwealth about the services that are out there. Just in Montgomery County not too long ago, we had a program called Minding Your Mind. And it was a mental health awareness program, and we had many parents attend. And many of the parents had children who are experiencing mental health challenges, whether, as I mentioned, whether it's bipolar or depression and so forth. And you know, they were very pleased to hear from the professionals about developments in the field of mental health, some suggestions for therapy, medication, and so forth. So we feel that we've made great progress, but one of the biggest issues that we hear quite a bit about is the stigma that's attached to people who have mental health challenges. And you know, this is something that we probably have to address best by education, by educating people about mental health issues and so forth.
Recently you had a great accomplishment. The Disability Bill of Rights was passed out of committee and sent to the House for a full vote. This was something that you were working on last session, but didn't get to the finish line. Where are we with that?
That's a good question. Our Disability Bill of Rights is long overdue, legislation that's long overdue. And it recently passed out of the Human Services Committee, and it will go on to the full House for a vote. And the Disability Bill of Rights is significant for many reasons, not the least of which is the fact that it formally recognizes in statute the fact that people with intellectual and developmental disabilities have the right to participate in their own decision making, whether it has to do with a job, are they going to work a job, where will they work, where will they live, is it going to be a group home, will it be an institution, will it be with their family, and so forth. And this is important legislation. One of the most important components of the bill is that it manifests and calls on the Commonwealth to actually comply with the Olmstead decision. The Olmstead decision is a Supreme Court decision which says that every state must have a plan for caring for their adults who have developmental and intellectual disabilities. And Pennsylvania has yet to completely comply with this. And our bill calls on the Commonwealth to actually articulate that plan, taking into account our resources and so forth.
How important is this Bill of Rights to mental health patients?
Well, over the years, you know, we have not given our brothers and sisters who have intellectual or developmental disabilities the credit that they deserve. We have not allowed them to participate in their own decision making about their own lives in the magnitude that we should have. And we've made great progress, but this bill actually calls the Commonwealth out, if you will, and says that these individuals now should be participating in their own decisions relative, as I said, to where they live, where they are going to work, and so forth. And many of these individuals that I'm referring to work jobs, pay taxes, care for themselves, live independently or semi-independently, and this is an initiative whose time has arrived.
You introduced this bill last session, as we mentioned. Were there any significant changes between last year's bill and this year's bill?
The bill is pretty consistent, although you ask a very good question. The component of the bill that requires the state to develop a plan for caring for adults, for programs and services for adults with developmental and intellectual disabilities is a tad controversial because the funding is not there yet. I have introduced many measures that are revenue builders, revenue enhancers, where the money will go to care for adults with special needs, but none of that legislation has passed yet. So we believe that the mechanisms are out there that would appropriate this money. But the bill is very similar to what has been done in the past. And unfortunately, in the past, we have not gotten it moved. But there seems to be more enthusiasm. The bill seems to have more traction this session than it did in the past. And also, we have received preliminary indications that the Wolf administration is supportive of our legislation. So we have been working with them in drafting an amendment which will clean up some of their concerns. And we are been cooperating with them in that regard.
You had mentioned that this session the bill seems to be gaining more traction. What do you attribute that to? Is there anything particular that you think has affected this?
Well, that's a great question. And I believe the answer is that the disability community has been galvanizing, has been organizing better, have been coming to the Capitol to participate in rallies, have been participating in advocacy and outreach activities, and have been educating our elected officials about people with disabilities. And our Speaker of the House, Speaker Turzai, has frequently expressed his support for what we are doing. And he reminds us that everyone has a disability of some magnitude. And he has been very supportive of our efforts, and we are very, very grateful to him. But I really believe it has been the outreach of the advocacy community.
And additionally, you're the prime sponsor of another bill that was recently introduced, and it's a waiver for the inheritance tax if money is set aside by families for someone with disabilities. Why did you feel that was an important move to make?
Good question, Anthony. And the answer is that many families who do not have a funding stream, they do not have adequate funding or what we call a waiver to care for their adult child, their son or daughter, they don't have the resources to do so. We try and help. And this is one way to do that, to waive an inheritance tax on assets that are set aside, put into a trust account to care for an adult child with special needs. There are many families in Pennsylvania where the parents are literally 90 years old. Some are older than that, some are 92, 93, in every legislative district. And they care for a son or daughter at home, and the son or daughter who has special needs might be 65 years old. The parents are experiencing age and health-related issues. Their son or daughter for whom they care might be experiencing age and healthcare related issues. And we are doing our very best to support those families. And until there is enough funding to provide waivers to all the people that need them, deserve them, we believe that we should be doing as much as we can to help those families with their expenses.
And finally, we're only 6 months into the new legislative session, but obviously your subcommittee has been very busy. What can we expect to see coming out of the committee in the future, and is there any other issues that you plan on tackling sometime soon? One
of the biggest issues as it relates to mental health challenges is what's called mental health parity. And mental health issues, challenges, are not like having a broken arm. A broken arm can be diagnosed with an x-ray, can be set, and an individual with a broken arm can be playing basketball in a matter of months. It's not so simple with mental health. Sometimes it takes months, sometimes even years to peel back the issue, and for an individual who is having a mental health challenge to really manifest and to really reveal the nexus of their mental health issues. And that's just to make the diagnosis. And then, of course, there could be months, years, even decades of therapy. And this is expensive. And we believe that our health insurance providers, the insurance companies, should do a better job of providing mental health parity. They should be providing health care for mental health challenges in the same magnitude as they do for a physical problem.
All right, Representative Murt, thanks for joining us today. And as we said, only 6 months into the new session, but your committee's been very busy. Congratulations on that, and looking forward to see what comes out of it in the future.
Thank you, Anthony. I appreciate it.
If you have comments or questions about this or any other legislative topic, Representative Murt's contact information will be on the screen in just a moment. Thanks for spending a few minutes with State Representative Tom Murt.